Hello, hi, thank you for joining me. This is Dr. Erica, pharmacist for close to 10 years now. Thank you for joining me. Please like, share, and subscribe to this channel. I am the pharmacist, Dr. Erica. Thank you again. This particular channel hosts educational information for pharmacy students, for medical students alike, and also for those who just want to know about medication in general, how to treat themselves, self-care, how to be nutritious and be active in the community and outside to better their weight and their overall wellness. So please stay tuned to the end of this video. Again, I'm Dr. Erica, and this particular video is answering the question, what are the benefits and risk of hormone replacement therapy? Hormone replacement therapy includes two items that can be your estrogen products as well as your progesterone products. Now, these products can be in combination, is what we call combination estrogens, or they can be in uh, singular. They can be utilized alone, just depending on the particular individual's care needs. Okay, so estrogens in particular are the mainly ingredients that you're going to come across when dealing with hormone replacement therapy, especially in those who are postmenopausal and who have had hysterectomies, who have had surgeries, those who are perimenopausal, those who are over the age of 35 or perimenopausal can also be dealing with estrogen products alone, just for regulation of hormone therapy. Also for reduction of those symptoms that perimenopausal and postmenopausal women deal with, such as those hot flashes or those night sweats, things like that. Dryness, things like that is what most estrogen products are used for in those age groups and populations. So do understand that. Now, there are some benefits, not only benefits, but risk with taking these medications, especially for those who are over the age of 35 years old, and also for those who um, use these particular medications long term, say for greater than 5 years or greater than 10 years at a time. Cancers can form as well, such as ovarian cancer, for those who are taking estrogen products for greater than close to 10 years in duration. So do understand that. Also, there's gallbladder disease that could form as well, and there are breast cancer risk, there are ovarian cancer risk, there's endometrial hyperplasia risk as well. And also understand there are bone mineral density issues that can go along with taking these estrogen products. So do be aware of that. Now, those who are over the age of 35 years of age can request a low dose estrogen to help reduce these risks. And most doctors will go ahead and do that initially. Now, with progesterone, progesterone is a natural hormone that we have in our bodies, but because we want to regulate our hormone steps more consistently, we can introduce progesterone and estrogens into our body systems to help with that. Now, some of the risk of progesterone maybe like her hair growth, unwanted hair growth along the facial line, unwanted hair growth in women, not only that you may see around the cheek or the chin area, but also around the lips as well. That unwanted hair growth is one that is very much known with progesterone therapy. Also, headache and depression are some of the risks that you may feel with progesterones, and irritability can also be a risk as well. Some of the benefits are going to be, again, the reduction of night sweats, the reduction of hot flashes and those warm episodes that most perimenopausal and postmenopausal women go through. Also, vaginal dryness or vaginal atrophy. Again, colon cancer risk are reduced with estrogen and progesterone products, and also bone mineral density is also better because of the introduction of the estrogen and progesterone. So do understand that. And also, it helps, these hormones help to reduce endometrial hyperplasia, which means that growth of cells outside of the vaginal wall, outside of the uterine wall, will also be reduced. And that is a plus when taking estrogen products. Again, if you can minimize the use of estrogen products to less than 5 years at a time, that would be great to help reduce cancer, decrease the cancer risk of the ovaries and the breast, as well as endometrial cancers as well. And then if you have to use it for longer than 5 years, your doctor can maybe reduce the amount of estrogen that you use to a low dose form. And I do recommend that option. Okay, so some products of estrogen, I'll go over some of the products that you may come across in prescriptions. They're oral tablet forms, they're vaginal tablet forms, there are suppository vaginal forms as well, and then there's emulsions or these really soft foam dispensed. And then there are also patches. There are tablet oral, and then there's patches, and then there's also the topical creams as well, vaginal creams, and there's gels as well, topical gels that can be used. And then you may also see sprays. Some items may be dispensed as sprays, like spray on the topical on the skin itself for use. So do be aware of these different forms that are available. And they come in different brand names, different strengths, and the brands are always changing. Some brands have been on the market for a long time. Some brands are new to the market, just depending on what's the latest out there. So do be aware of what's the latest, okay? And your doctor will usually keep up with that information as well. And you can do your own research too by researching websites as well as researching what has been on the market for such a long time and have worked for women previously. So do stay in the know about that information, okay? So thank you for joining me for this particular video. I hope I've answered the question for you very well. If you have any questions or comments, please let me know. Please like, share, and subscribe. I'm Dr. Erica, pharmacist. Thank you for joining me. I hope to see you on the next video. Take care. Bye-bye.